Hello, everyone, and welcome to our training webinar today for compassion fatigue and self-care. My name is Shannon Fish. I am a licensed clinical social worker and the Director of Operations and Risk Management for Children and Families First, a nonprofit in Delaware. And with me today is also Kira, who'll introduce herself.
Hello, everyone. My name is Kira McGillivray. I'm a licensed marriage and family therapist and the Chief Program Officer of School-Based Initiatives at Children and Families First. And together, Shannon and I are the co-directors of the Brain Science Training Institute.
So the Brain Science Training Institute of Children and Families First provides trainings to the public on brain science, architecture, toxic stress, and resiliency to organizations and individuals and groups. And if you'd like to learn more, you can scan the QR code and get to our website from there. Today, we have two primary objectives. We'll be discussing what is burnout and compassion fatigue and vicarious trauma to really understand those definitions. And then we'll be identifying strategies and ways to cope with vicarious trauma and burnout and compassion fatigue when it does show up. So let's start with understanding what these terms are. We'll start with burnout. Everyone has probably heard this term before, maybe used it before, said that you're feeling really burnt out, but it's important to have a basic definition for it. So burnout is this idea of being emotionally or physically or really mentally exhausted because of the amount of work that you're doing. Burnout is tied to the institution or the organization or the job that you do. And it's really built up over time. One event does not necessarily create burnout. It's this constant feeling of being overwhelmed or just drained or unable to meet the demands of the work that you have to do. It's important to note that burnout is a type of stress, but it's not tied to the trauma or experiencing trauma like compassion fatigue and vicarious trauma will be. So then we have compassion fatigue. And compassion fatigue will feel very similar to burnout in terms of the fact that it is a type of stress, but it affects us in the way that we're unable to really empathize or really feel compassion for others. And it's sometimes described as this cost of caring in the helping profession. Unlike burnout, compassion fatigue doesn't have to be cumulative. One event, one stressful contact with a patient or a diagnosis can really create compassion fatigue. And it is related to being exposed to stress and exposed to trauma, to hearing the stories or the effects of the patients that you serve, and then being able to kind of feel that intensely yourself. We also have vicarious trauma. And vicarious trauma you can think of as kind of compassion fatigue 2.0. And we'll be using those terms interchangeably today. But vicarious trauma is when our compassion fatigue starts to actually transform ourselves. It disrupts our sense of self, our meaning, our hope, sometimes even our spirituality. And it's that kind of negative cost of caring times two. Like compassion fatigue, this is due to being exposed to the stories and the stress of the clients or the patients that you serve, but it's taking on their trauma as well. So when we're talking about burnout and compassion fatigue, it's important to understand who is at risk for these types of toxic stress. And at the end of the day, anyone within the helping professions is at risk. In the helping profession, burnout and compassion fatigue are really considered kind of occupational hazards. It's something that you're likely to be exposed to, and so we need to understand it so we can take steps to mitigate it. To be at risk for compassion fatigue or burnout, first, really, we need to be exposed to the stories of others, to really hearing that stress. But we also need to have empathy for it. If we don't have any empathy, then we're hearing these stories, we're hearing things, and it's not really traumatizing to us. It's not going to take a toll on our mental or emotional state. And then finally, the third piece is that we have to have responsibility for the story or for the person that we're serving. So listening to the news can be very distressing, but it's not going to be traumatizing. It might not create compassion fatigue because we don't have responsibility to people on the other side of the world. But we do have responsibility to the stories and the stress of those that we serve. And so if we empathize with them and we hear it and we see their stress, it can take a toll on us. Now, when we talk about stress, it is important to know that not all stress is bad. We actually need some stress in our lives to be able to get up, to be motivated, to get through the day to day. So there's actually three types of stress response that we can have. First is positive stress. This is when we have brief elevations in our heart rate and our stress hormone levels, and it kind of gets us going a little bit. You might experience positive stress if you're speaking in front of people, you're going to a job interview, you're exercising. These all create kind of positive stress responses in our bodies. Then we have tolerable stress. This might be when we're having some serious stress response, but it's buffered by supportive relationships around us. So we might be experiencing a negative, stressful situation, but we have individuals who can help us kind of move through that stressful situation so that it doesn't stay and linger with us. Examples of this might be car accidents or medical injuries, and then we get care and support immediately after to help kind of regulate our bodies back down and move forward. Finally, we have toxic stress. This is that prolonged activation of our stress response system, and we don't have those buffers or those supportive relationships to regulate back down or to move through the toxic stress situation that we're experiencing. It is here that burnout and compassion fatigue and vicarious trauma can live, where we are experiencing stress in the workplace, but we're not receiving the supports to be able to move through that stress. So again, as we saw, not all stress is bad. And so in the workplace specifically, we want to be able to kind of be in this more optimal space. So when we're not experiencing enough stress, we're in the green space, we're maybe feeling a little laid back. This can be like we're trying to get ready for sleep at night or we're relaxing on the weekend. That's not ideal in the workplace. We need a little bit of energy to kind of get our work done, get the paperwork done, get through the day. So then we move up into optimal stress, which is where we want to be. We're experiencing enough of that positive stress that we're able to get through all of the tasks that we have. We're enjoying the work that we're doing, and we're moving forward. But if we stay up at that top space a little too long, we can start to move into that orange area where we're beginning to tip over into some too much stress. So this is where we might start to begin to feel the effects of burnout or compassion fatigue. We're starting to feel maybe a little mentally or emotionally or even physically exhausted. And then if we continue to stay operating that really high rate of stress, that high rate of workload, we start to tip into burnout and we go down into the red space where we're going to be experiencing really the effects of burnout or even compassion fatigue. And we want to try to avoid getting into that space, which we'll talk about later. So finally, as we're setting this foundation of what is burnout and compassion fatigue, these are some of the signs and symptoms of compassion fatigue specifically, but they're also very similar to signs and symptoms of experiencing burnout or any other toxic stress. So individuals who might be experiencing these, they can feel a loss of purpose that really ties into that vicarious trauma piece where they're experiencing so much exposure that they're not sure the work that they're doing is making a difference. They might have anxiety or irritability. They might have other emotional feelings, like maybe their emotions are a roller coaster. One minute they're up, one minute they're down. Sometimes they can experience the idea of like hopelessness. They also begin to start having some kind of cognitive challenges. So maybe they are feeling more hypervigilant, they're on edge, they're irritable, they can't concentrate. They might be forgetful or not be able to remember all of the things that they need to do. And individuals who are experiencing compassion fatigue or burnout can also start to isolate and withdraw from others. It can create appetite changes and sleep disturbance. And really, when you look at the full spectrum of how compassion fatigue and burnout can affect the helping professional, we can see that the cost can really be great. And so I'll turn it over to Kira, who will help us navigate through some strategies to address these.
Right. So to wrap up what Shannon just went over is that being present for other people's stories, being in that helping profession, you are giving your light, you are giving your energy to others. And just like a candle, to give light, you must endure burning. And so we really want to think about ways that we can protect ourselves and recognize what are our warning signals. How do we know that we're approaching that compassion fatigue or vicarious trauma or burnout? And how do we actively engage and practices that really help us stay in a state of what we call compassion satisfaction instead of that burnout, where we have those positive feelings and we can empathize and work with others, and instead of really taking a toll on our own stress, and instead of their stories really taking a toll on ourselves and creating stress. So, what we want you to think about just individually right now is what are your three risks that are placing you at risk of experiencing burnout or compassion fatigue at this time? And so these can be both individual or organizational. So, for example, an individual risk may be finances that are playing a role. It could be taking care of an aging family member. Organizationally, it could be a new project or a new leader. And so, just right now, take a minute to write down what are your three risks. Now that you've taken a moment to think about what are your risks, you want to be aware of these and how they may be impacting how you show up into the workplace, how it may impact the way that you are talking with patients or interacting with colleagues. Because if we're not aware of what's adding additional stress, we really can't take preventative actions to reduce that stress. Now, just as we're asking you to think about what are some of the risk factors, we also want to think of things that protect us from that stress. And again, these can be individually or organizationally. So maybe you have really supportive colleagues. Maybe you have vacation coming up and that's protecting you. So again, we're going to give you a minute to just think about what are three things that protect you. All right, now that you've thought about three things that can protect you from stress, we want to acknowledge that these are things we want to lean into when we are having those really stressful days, when we heard a story or we were with a patient and it was really hard to be there, it took a toll on us. We want to lean into those things that protect us from that stress. We also want to have what we call coping strategies that we can use to recharge and renew ourselves, our compassion, our empathy, and just our overall well-being. And so the first thing we want to discuss are what we call self-care practices. These are things that we do on a daily basis, kind of that support our vital functions. So getting enough sleep and relaxation. If we're not getting enough sleep, we all can kind of recognize that we tend to be a little bit more grumpy or impatient. We want to make sure that we're sleeping well. We also want to make sure that we're eating well-balanced meals and that we're eating on a regular basis. We want to engage with friends and family. So really what we're saying is we want to connect. We want to make sure that we're connecting with people around us. And then we want to have enjoyable activities or hobbies that we can engage in. So this may look like reading, or maybe this is exercise, maybe it's playing a musical instrument, but something that kind of renews and kind of nourishes your soul. Then we want to think about self-soothing techniques. So self-soothing techniques are things that you can do right in the moment. So after you've just worked with a patient, there's something that you can do after leaving the room that will actually be able to kind of soothe yourself and kind of, again, renew a little bit of your well-being. And so what we're going to do is we're actually going to practice one of those self-soothing techniques right now, which is called compassionate touch. Compassionate touch comes from someone by the name of Kristen Neff, and she focuses a lot on self-compassion. And so why we're teaching this exercise is because compassionate touch actually helps us release oxytocin, which is our love hormone. And oxytocin is actually the antidote of cortisol, which is our stress hormone. And so when you engage in this compassionate touch exercise, it's likely to kind of bring down that stress level into that more optimal zone that Shannon was talking about. So what I'm going to ask you to do is to get into a comfortable position right now. And if it feels comfortable, you're actually going to take close your eyes. And I'm going to ask you to take kind of 2 to 3 deep, satisfying breaths at your own pace. So when you're ready, you're going to take those breaths. And now you're going to gently place your hand over your heart. And you're just going to notice the gentle pressure and warmth of your hand. If you wish, you can actually place both hands onto your chest. If you do this, just notice the difference between 1 and 2 hands. Feel the touch of your hand on your chest. Just notice the natural rising and falling of your chest as you breathe in and as you breathe out. Now I'm going to invite you to make small circles with your hands on your chest. And if you need to open your eyes to look at me, please feel free to do so. But you're just going to make tiny, small circles, very gentle. You're just going to linger with this feeling. When you're ready, you can open your eyes if they were closed and come back. And now I invite you to kind of take notice of how it feels after you completed that exercise. There are lots more self-soothing techniques that you can do, just general diaphragmatic breathing. You can look up exercises. But there are many ways that we can just bring ourselves back into a more regulated state. The next thing we're going to talk about is self-management. And here what we're really looking at is managing our emotions. We have emotions all throughout the day. And if we just think about them at the end of the day, it's likely to be bubbling up with us all that time. And sometimes it can impact the way that we interact with others around us. So when we're talking about self-management, one exercise that we can do is something called a body scan. And a body scan is a very simple, short exercise where you just check in with your body and your emotions. So what you ask yourself is, what am I feeling? So you kind of do a scan from your head to your toe, and you ask yourself, what am I feeling? And you may express that you're kind of feeling a little sad, a little anxious. And so you're just identifying what that emotion is. And as you do that scan, you're also asking yourself, where am I feeling that at? So maybe I'm feeling the anxiousness in my chest or in my stomach. And then we ask, why am I feeling that way? And that really kind of puts together the thoughts and emotions so that we can kind of manage what we're experiencing and problem solve or figure out ways that we can approach the situation or engage in self-care practices. So you're asking yourself basically the three W's. What am I feeling? Where am I feeling it? And why am I feeling that way? And just doing that exercise can really help to relieve stress and be able to engage in activities in a more regulated state. We also want to touch on compassion fatigue, gratitude, sorry, as it's the most widely recognized self-care strategy in combating compassion fatigue. And so when we practice gratitude, we tend to feel more joy and pleasure. We're more resilient to that stress. We tend to have higher levels of positive emotions. We're more forgiving. We tend to feel less lonely and isolated. And physically, we have a stronger immune system because our adrenaline and cortisol levels are lower. So we also see lower blood pressure, less aches and pains. And individuals who practice gratitude tend to sleep longer and better. So it really is just a way to kind of change our pattern of thinking and focusing more on the positives and the things that are going well. And so when we think about kind of first aid for compassion fatigue, we want to remind you to first take a few long, deep breaths. Taking long, diaphragmatic breaths actually helps to kind of regulate your nervous system. And then we want to think about, again, what are some possible triggers? Why am I feeling this way in that moment? And then we want you to reach out to a supervisor or a colleague to debrief, to get support after hearing a story or witnessing something that's potentially traumatic, reaching out to someone to have a conversation. And then we want you to engage in an extra dose of self-care. And we say kind of dose because if you think about a vaccine, you wouldn't give a children's vaccine to an adult. It wouldn't be enough. It's not a strong enough dose. And sometimes after we have these incidents or experiences where it's very stressful, just engaging in our normal practices of self-care isn't helpful. And so we have to engage in that extra dose that's appropriate to the level of stress that we experienced. So maybe you're leaning in more towards those protective factors that we discussed earlier. Maybe you're doing more of your hobbies or activities that you enjoy that week. Maybe you are getting more sleep that night. Whatever it is, thinking about ways that you can replenish that self-care. And so here are a few of our references for you to review. And we thank you so much for joining us today in our webinar, and we will see you next time. Thank you.